MacuHealth is a nutritional supplement leader. Our targeted formulas include MacuHealth for daily eye health, MacuHealth Plus for aging eye support, Vitreous Health for vitreous care, Vision Edge Pro for visual performance in athletes, TG Omega-3 for ocular and systemic wellness, and MacuHealth DM for eye and metabolic support. Call MacuHealth today and mention this podcast for special discounts. Experience the difference with MacuHealth. Nutrition you can see.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight one day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. Welcome back to part 2 of my interview with Dr. Elisa Song. In part 2, Dr. Song discusses the problems associated with overusing antibiotics in children. If you're new here and you like our interviews, press like, subscribe, share, and hit the bell. Also, please leave comments. Be sure to watch our full-length documentary, Open Your Eyes, on Amazon Prime, Apple TV, iTunes, Google Play, and YouTube Movies and Shows. I want to ask you about ear infections, and, this will bring us to the microbiome, but, I remember when my older kids were young, they both had ear infections. And this was before I became interested in my interest in functional medicine. And I started going to IFM meetings. And they were both put on the gum medicine.
Yes, the pink bubble gum medicine, amoxicillin.
For
Yeah.
a year. And they were both, and I swear that because of that, it affected my daughters, the size of her hands. I feel it affected her growth. I just really feel by being, I know I can't prove it. I mean, this is just me and Anna one as a parent, but I just feel it really affected her really negatively. And even my son, I don't think he grew as tall as he could have been if he wasn't on these prophylactic antibiotics for a year. So my question is, are pediatricians still doing that? Do they still give prophylactic antibiotics for ear infections?
Not so much prophylactic. I mean, if there's ear infection after ear infection after ear infection, there might be. Although I will say, it's not as common.
Mm-hmm.
I hope. And also, really since about 2013, which is now 11 years ago, actually, I'm trying to remember, I think it was even before then, the American Academy of Pediatrics came out with a policy statement saying that for the vast majority of ear infections, there should be like a 48 to 72 hour watchful waiting period, knowing that most ear infections are going to resolve on their own. So not to just go to the pink bubblegum medicine, immediately. Now, are most pediatricians doing that? It's kind of, even not yet, right? And it is hard. I totally understand. When you have a baby or a child who's screaming in pain and, you're in the office and the parents are looking at you, please do something. And you just want to do something. And you just, and that, antibiotics may or may not help. It's challenging, right? But when we understand the consequences, not just, not just the ear, but the longer term consequences of what happens when we take that antibiotic and it disrupts their gut microbiome and the impact to their gut immune system connection, gut brain connection, gut hormone connection. We were talking about mitochondria before, the microbiome mitochondria connection, all of that. We can then step back and know, okay, it gives me more confidence to wait and watch. And also for me as an integrated pediatrician, I have a lot of other things under my belt that I can actually use as effective tools to clear that ear infection, like garlic ear drops, which have been in the studies shown to be effective for treating ear infections, both viral and bacterial. And we know that at least 40% of ear infections are viral, for which antibiotics are not going to do a thing. We also, can use, I use homeopathy and acupuncture and acupressure in the office. There's so many things we can do from a more natural standpoint to try to help your child with their ear infection or their cold or flu, or whatever else it is, to try to reduce the need for antibiotics. Um, Probiotic supplements. Probiotic supplements have been found to significantly reduce the need for antibiotics in children after colds or flus, especially if given consistently, particular strains given consistently through the winter cold and flu months. In fact, probiotics have been found to reduce the rates of missed days of school and missed days of work for the parents. Simple intervention, right? And then if antibiotics are needed, like and we can't go back in time and know for your kids, okay, were they really needed? And sometimes even doctors, if you ask them, is this really necessary? They may not have the other tools to know whether or not, oftentimes it's kind of I have to be honest, it's kind of a crapshoot. We just make these assumptions because we're not going in there sticking a needle in their ear, taking out the fluid and culturing whether or not there's bacteria in there. But if antibiotics are used and hopefully necessary, then what I would wish for every parent and pediatrician out there is to help that child recover their microbiome after antibiotics so that they can continue to grow as optimally. Their brains and mental health can continue to thrive. So it's I think just having that information and that informed decision making is really powerful.
And there are different types of antibiotics that may be good for probiotics that may be good for cold and flu, like NCFM. Can you
Oh
talk,
yeah.
can you talk about that a little bit?
Yeah, yeah. There's one I mentioned that, there's been actually several studies at this point now showing that probiotic supplements can reduce colds and flus and fevers and, missed days of school and also antibiotic prescriptions. But they have to be specific strains. You can't just go out and get any particular antibiotics. And so there's two strains that I will use in the wintertime, and I have specifically in an immune probiotic. It's lactobacillus and NCFM and bifidobacteria BIO7. They're just two of these strains. You can find them in different probiotic supplements. We have them in our Healthy Kids, Happy Kids immune probiotic, which again, that is specifically for immune support. Now, if I'm working with the child to support their eczema or to support their anxiety or ADHD, I'm using different probiotic strains that have been shown to be more effective at improving serotonin and dopamine levels or improving the microbiome skin access. So we just have to be knowledgeable about which strains. Now, that being said, supporting your overall gut microbiome is going to help your child's immune system, and it's going to help their mental health, and it's going to help their sleep and all of that.
Before you talked about butyrate and bifidobacteria. Can you explain a little bit more about that and the importance of it?
So bifidobacteria is one broad um, family of bacteria in our microbiome, and we have many different kinds of bifidobacteria. In infants, the most predominant should be Bifidobacteria infantis, right? But there's also Bifidobacteria lactis, there's Bifidobacteria adolescentis, which is, more important during our teenage years. But one of the things that we've seen through the decades, over this past century, as researchers have really followed microbiomes, we're finding that babies, children, and adults are gradually losing their abundance of bifidobacteria species, which is especially important for babies, where that bifidobacteria starts to talk with our immune system and help support a healthy immune response to foods, to our environment, to infections, so that that reduces the risk of things like eczema, asthma, hay fever, food allergies, all of which have been skyrocketing, right? That bifidobacteria can also help produce healthy brain chemicals or neurotransmitters for us, including serotonin and dopamine, and can help our um, hypothalamic pituitary adrenal or HPA axis stress response. And so it's really important. Now, I do a lot of microbiome testing on infants, and we have to also know that a baby and a child's microbiome looks very different than an adult's microbiome. So we need to use a pediatric specific test that has pediatric specific reference ranges. And in fact, even for adults, we now know as teenagers go through puberty and then become young adults, young women or young men, and then, as a woman become a perimenopausal or postmenopausal woman, our microbiomes change. So gender, sex, and age matter for your microbiome to know what's quote normal. We're going to be at an age, hopefully not too long from now, where we can really have more precision microbiome testing and analysis. And the current test that I use is by a company called Tiny Health, which, full disclosure, I'm their chief medical officer, but they're the only test that's really putting in the science to use shotgun metagenomics testing, which is the gold standard for beyond PCR testing and culturing for microbiome analysis, and also using the genomic analysis to look at your microbiome function, and then taking all of the data with their results that they receive to have age specific norms. We don't yet have sex specific norms, although what's fascinating is they can find signatures for young women and pregnant women on risks for your microbiome signature risks for PCOS or gestational diabetes or preeclampsia. Now, for babies, going back to bifidobacteria, they should have up to 80% or more bifidobacteria in their gut. They should have very little diversity. And for the listeners who are, who have done functional medicine testing, maybe for themselves or your practitioner, we are so used to thinking you want a lot of diversity, a lot of different kinds of bugs, beneficial bugs in your gut. That is complete opposite for babies, up until really the first, year and a half of life. And even then from the first, year and a half to 3 to 5 years of life, there's rapid change. And so we want that bifidobacteria. Dr. Sabine Hazen during the pandemic, she did a lot of she's a microbiome researcher, and she did a lot of microbiome testing on adults and found that the lack or lower levels of bifidobacteria in adults also corresponded with worse COVID outcomes. And we are seeing how important bifidobacteria is, not just for infants but also for adults. So I'm very, for children, especially when there is a risk of, in the family, there's already eczema and asthma and immune problems or mental health concerns or ADHD. I want to start with a stool test, from, maybe 1 month of age, just to see, are they getting on the right track? And better yet, optimize mom's gut and vaginal microbiomes before birth.
So what are you finding when you're doing these tests on the kids, the infants? Are they at the 80%? Or are they a lot less? Most of the kids in your practice?
Most of the kids are not. Yeah. Yeah. It depends. I mean, um, some kids are. Now, what's interesting is there's also going to be a difference between whether babies are breastfed or not, because breast milk is rich in a prebiotic factor called HMOs, or human milk oligosaccharides. Now, HMOs in human breast milk, they specifically feed bifidobacteria. It shows you just evolutionarily like what was important for baby's gut. It was bifidobacteria. That's why mom's milk was designed to specifically feed bifidobacteria.
So these sugars are not for the baby, they're for the bacteria within the baby.
Absolutely. That's so key, right? The lactose in breast milk is for baby's energy and fuel, but the HMOs is for their microbiome, which supports their brain and their immune development.
So
So,
that sometimes is scary is that they start getting skewed toward TH17 or TH2, and then you start
yep.
seeing eczema all over the baby. Can you talk about that a little bit?
Yeah. Well, that does also correlate. We typically find, again, we can see through tiny health testing these quote signatures, these microbiome patterns that tell us, this baby might be at risk for moving into that atopic march of eczema, asthma, allergies. And so and that corresponds with lack of bifidobacteria, maybe higher levels of dysbiotic organisms or particular gram-negative bacteria that can be there. So if we can clear that out, and normalize our gut microbiome, we can significantly reduce that skewing towards the Th17, Th2 that is more seen in eczema, asthma, and allergic diseases. And what's really, what a lot of people should know is, I mean, we've known about this for a very long time. I mean, there was a huge study in 2016. It was nearly 800,000 children. It was a military study, so they looked at hospital records, and they followed babies who were given either antibiotics or antacid medications in the first 6 months of life. And they tracked them and found that by 4 years of age, those babies had a significantly higher, sometimes even double the risk of developing every single allergic disease compared to those babies who did not receive antibiotics or antacid medications. Now, why is that? Well, antibiotics, they're not specific in killing just the bad stuff, right? They wipe out all the good stuff. And also antacid medications can disrupt the gut microbiome as much as antibiotics. So now, if we know that a baby is getting antibiotics or antacid medications, you bet one of the interventions needs to be restoring the microbiome, getting in bifidobacteria, probiotics, getting in HMO supplements. There are actually now companies that have HMOs that are manufactured. They're not from human breast milk, but they're synthesized and support the growth of bifidobacteria. And I recommend these HMO supplements to not just babies, but also kids, teenagers, and even to adults if they don't have enough bifidobacteria.
And how about replacing the bifidobacteria? Which companies would make those type of supplements?
Mm. There are several. Claire Labs, their infant formula, is high in bifidobacteria. So is, Designs for Health has their Probiomed infant, powder. But over the counter, I've actually had good results with Jarrow, their baby Dophilus, which is I think it's called baby Dophilus. These companies change the name sometimes, but that's high in bifidobacteria. You want to see, for the babies, you want to make sure they have some sort of a bifidobacteria infantis strain, but there are lots of other bifidobacteria strains. So having some bifidobacteria lactis and some other kinds of bifidobacteria can be really helpful too. But I do see on testing that those supplement companies, and there are others that can do a good job.
Would you recommend bifidobacteria across the board or only if the bifidobacteria is lower than the 80%?
That's such a good question because that is something too that, I used to say that, oh, no matter what, all babies, why not give them some probiotics, right? Or all kids, all adults, we should all be taking probiotics. The problem with that is sometimes we can then start crowding out your baby's own naturally developing microbiome and beneficial flora. And sometimes you can have too much of a good thing too. And so I typically, if there's been a disruption that we know of, like a C-section birth, or if moms were given antibiotics around the time of pregnancy or before delivery, and let's say for group B strep, she got antibiotics, or the baby received some antibiotics, or the baby is formula fed. I mean, why these factors? Because we know these factors can change the microbiome from a healthier pattern to a less healthy one. Then, I would give the baby some probiotics, um, bifidobacteria-based probiotics, in the beginning, not necessarily every day, but put some in the bottle, and maybe for the first month, and then test their stool to see, do we need to keep going? Otherwise, for, a baby who is born vaginally, no complications, breastfed, I still do like to check their stool microbiome because sometimes babies will veer off course because of the microbiome in your family, right? The dad's microbiome, or if grandma is living with you. And so we want to still make sure that they're headed on the right trajectory because that is the best way to set their health off to the right start as they get older.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
And about 33% of births in this country are C-sections. So if you're starting off with a C-section, should you be starting off with probiotics as well?
I do think that that is a good idea. So if your baby was born by C-section, or you received antibiotics around the delivery, because even, for vaginally birthed babies, if mom had group B strep positive, I mean, they'll get IV antibiotics, which then will get to the baby. So in those situations, I just would go ahead and start a bifidobacteria probiotic. There's one called Avivo, which is just one probiotic strain. It's one bifido strain. I think it's EVCO01 or something like that. But there are some good studies around Avivo and bifidobacteria colonization, reduction in the rates of, eczema and allergies. And so you could just do that one. You could use the clear baby probiotic, maybe for about a month. We also have to know that the younger you are, the more changeable your microbiome is. So just a little bit can really set things off in the right way, as opposed to an adult. I mean, by the time you're a teenager, or let's say an adult who's had, dysbiosis for years and years and years, yeah, it can take months of working on the gut, or longer, to really get the gut back in order. But for babies, it just takes little shifts.
And what are the things that make the gut bacteria the wrong type? The ultra-processed foods, a lot of sugar. If you could discuss that a little bit.
Yeah. Well, in my book, I talk about what I call microbiome mischief makers, right? All these things that they don't necessarily always cause damage, but they sure, set that in motion, right? And when we think about our foods, ultra processed foods are one of the biggest culprits. I mean, the added sugars will specifically feed the wrong kinds of microbes in your gut. But we also know in ultra processed foods, there's a particular category of foods called emulsifiers. Um, that can disrupt the gut microbiome, increase gut dysbiosis, trigger leaky gut. And this is not just for kids, it's for adults too. In fact, there was one study looking at mothers who had higher levels of emulsifier consumption during pregnancy, leading to worse health outcomes in their babies and their children. And so we want to now, it's not going to say emulsifier in the food package, right? So I teach kids how to read the food labels and look and see what are the biggest culprits. Well, carrageenan, mono and diglycerides, xanthan gum, CMC is also called carboxymethylcellulose. I mean, I list a lot of these food additives in the book. You don't have to memorize all of them, but once you start looking at the labels, you'll start just by visual memory. Oh, that mono and something. Okay, I'm putting that back. Right? You don't have to remember necessarily, oh, mono and diglycerides, but now my kids know when they look at ice cream, if they want ice cream for dessert, I have them go to the, freezer section. Go ahead, pick out an ice cream, but make sure it's one that we're all going to be happy with. Like, you're going to be happy with the taste. I'm going to be happy with the ingredients. And they know to put back the ones that have mono and diglycerides, which shockingly are quite a few of them. I mean, ice cream should have, cream, sugar, and maybe some vanilla or whatever else you're putting. That's it.
And they put that in it to kind of keep everything together so it doesn't kind of fall apart on you.
That's right. That's right. So, if you're getting more whole food ingredients, I mean, they should spoil at some point, right? I mean, they're not going to look perfect after, 2 months. I mean, there are foods that have an expiry date and don't need the emulsifiers to keep them together.
Now, kids are going through puberty sooner than they used to. And how does the gut microbiome affect going through puberty sooner? And what's the downside and what causes kids to go through puberty sooner? Because I know in some of the Asian countries, at least before they became westernized, the girls might go through puberty at 17, where here some of the girls are going through starting puberty at 9 years old. And that
Or
can't
younger. Yeah.
or younger. Tell,
Yeah.
tell us about that and tell us how to prevent that. and the
Yeah.
danger.
Well, when you go through puberty earlier, you also stop growing earlier. I mean, that's one thing, right? I mean, for a girl, um, estrogen is what's responsible for starting to close your growth plates, which then once your growth plates are closed and your bones are adult-like, there's no more growth. You stop growing. And for girls, that biggest trigger is estrogen. Now, why are kids going through puberty a little later? The other interesting thing is I'm also seeing boys on the flip side going through puberty later. And I've had to do more workups on boys over the past several years on do they have delayed puberty? So we're seeing this kind of, I'm seeing this, and nobody really talks about that part of it, right? Where we talk because periods are so obvious. I mean, there's something we can really put our research and know, okay, this was when your period started. But for girls, seeing a little earlier, puberty starting. For boys, I'm often seeing a little later puberty starting. There's an intimate connection between your microbiome and your hormones because as you go through puberty, estrogen and progesterone and testosterone starts to change the composition of your microbiome. So that is why we see during puberty, boys and girls microbiomes, there's a sex difference. They start to look different. Okay. It's not good or bad. I mean, this is just how we were, evolutionarily devised, right? Our microbiomes are different. And then our microbiome also affects how these hormones are processed and detoxified in our systems. And so, it's sort of this two-way street. If hormones are kind of kicking a little bit too early, it changes our microbiome, and then our microbiome, changes the way our hormones are presenting themselves in us. Now, why is this happening? I mean, one of the biggest reasons is really all of these endocrine disrupting chemicals that our kids are now exposed to. And yes, as a family, you can, try to live as clean as possible, not have any parabens, in your baby shampoo, or in on their body wash, using phthalate free, containers, glass Tupperware, all the things. I mean, there are things that we can do proactively, but we're still all of us exposed to PFASs or forever chemicals. We're all exposed to microplastics. There's only so much we can do in our world. Now, we need to have better environmental control so that there's less exposure for all of us, but we're all going to be exposed. I mean, for the rest of our lives, we can't change that. And honestly, there's probably nowhere in the world you can go where you're not going to have some exposure. And I also don't want your kids living in a very lonely, isolated little bubble where they can't touch anything and can't eat anything except for what's very controlled, because that's not healthy either, right? Um, but these endocrine disrupting chemicals, what happens? I mean, some of them do look like estrogen, so they'll trigger these changes in your microbiome a little bit earlier. But what's really fascinating is when you really dive into why do these endocrine disrupting chemicals or hormone disrupting chemicals exert their negative impact? Because we know that these hormone disruptors, they don't just affect hormones. We can see in kids that it affects their neurodevelopment, affects their mental health, affects more than just hormones. So I think we need to move away from calling them endocrine disruptors or hormone disruptors. They cause their negative impact by disrupting the gut microbiome. Virtually all of them, I mean, even heavy metals, have been shown to cause gut dysbiosis and even increase leaky gut. And so we know then if the gut is disrupted, that has a ripple effect on every single organ system, which is what we're seeing with these quote hormone disruptors. So the one research paper that I read, which is a great one, really calls for a change in calling them endocrine disrupting chemicals to microbiome disrupting chemicals, because when we look at them from the lens of the microbiome disruption, we can see why there's a ripple effect. And so I think that's really, bottom line. And then we step back and realize, okay, so we have these endocrine disrupting chemicals that really disrupt the microbiome. There's so many other factors in our modern world that are going to disrupt the microbiome as well. And we mentioned some ultra processed foods, but EMFs, Wi-Fi and some small studies have been found to disrupt the microbiome. Psychological stress, which I mean, even toddlers, nowadays are going through increased stressors, let alone our teenagers, right? So, and not just antibiotics. We mentioned antibiotics and antacids, but there's a whole list of medicines, including antihistamines, birth control pills, steroids that are very common in childhood and adolescence that have been shown to disrupt the gut microbiome as much as antibiotics. And like ibuprofen, NSAID medications, all of those. And so, you know, many parents now are savvy and know, oh, if I take antibiotics, I'm going to give probiotics because I know that messes up my child's gut microbiome. But they're not thinking, oh, if I give them ibuprofen for a headache, or a teenage girl takes ibuprofen for her period cramps. They're not thinking, oh, how do we support the microbiome then, right? Or it's allergy season, I'm giving Claritin. How do I support the gut microbiome? So we need to make supporting our gut microbiome not just a one-off, take probiotics here and there. We need to make it an everyday. Hey, let's nourish our microbiome just like we think about nourishing our kids every day.
Interesting. I saw a study on GLP-1s, and it actually, because I thought maybe it would make the gut bacteria worse, but it actually there's I saw a study that it improves it. Have you seen
Interesting.
that there actually was an improvement with the GLP-1 medications, the Wegovy's, the Ozempic, Mounjaros. So I just thought that, because I wanted to ask you about that, and I looked it up before about that and what it does to the microbiome. And I saw that it was a positive effect, but I thought that was interesting. But you said something before that was very fascinating, that the boys are delayed puberty, where the girls are going through earlier puberty. Now, delayed puberty, you said they keep growing, but I guess there's a point where it's too delayed and that becomes an issue. Talk to us a little bit about that. Tell us about what that means.
Yeah. Well, and I'll just make a little side comment on the GLP-1. I mean, of course, we have to, we want to keep that open mind to, what the research shows. And that is fascinating. I wonder if it's, with GLP-1 and its ability to modulate and help normalize our insulin sensitivity. We know that, blood sugar regulation, and that's why added sugars can really wreak havoc on your gut microbiome. And so, that to me, I wonder if there's a look at whether or not it has to do with insulin sensitivity. I mean, I think that's fascinating because I see so many more signs of prediabetes in our kids, even slim, active children. But when it comes to boys, with later puberty, I mean, it's not a ton of boys, but they're boys who, I mean, and they're still growing. They haven't stopped growing, but it's very slow. So these are the kids who are, we're just waiting. Oh, they're just a late bloomer. Dad was a late bloomer. They'll have their growth spurt in later high school. And we're just kind of waiting, waiting, waiting. But when it gets to, when they get to closer to like 14, 15, and there's no signs of hair or a little voice deepening or, some acne, like just, then I start to think, okay, now are we getting to the point where we have to start thinking about it? And so most of the time I don't worry, but once we're hitting that older mark, I do check some hormone levels to see are things kickstarted underneath, right? That and we're going. But I do think that too, if it's not falling in the range of, if there's no one in the family that was a late bloomer, so it's not necessarily constitutional, familial, then I do think, looking at the microbiome can be very helpful because again, that's going to be the foundation of how our body manages hormones. And then also I want to make sure that we're removing any sources as much as possible that could increase or mimic estrogen in that body, right? So like, uh, I mean, trying to really reduce exposures to environmental pollutants in the home. I know for for my son, he and his friends are all about the scents. And so, not perfume, they're scents. But I tell them, look, I mean, look at these ingredients in here, right? I mean, that is not going to help you become as strong and athletic as you want to, right? Let's take a look at these chemicals and see how that's impacting you. And everything you put on your skin is going to be absorbed. And so, I mean, I just do some digging into, what else they could be exposed to that might be impacting them.
That's so funny because I have a 15-year-old, and it's like they're collector's items, these scents or these colognes. I forgot what they call it, scents or but it's they like compare who has like a fancier cologne. It's like when I was growing up, it was baseball cards. They're collecting scents. It's very
It's
crazy.
so funny. Yeah, I have to laugh at them, I want to um honor that this is something that he's interested in, but also make sure that he's making, informed choices on what he's choosing to put on his skin.
Well, that brings to the autoimmune issue because the autoimmune disease in kids has doubled about in the last, what, 20 years or so.
Yep.
That is pretty much related to the microbiome. Is that correct?
Yeah, absolutely. I mean, for sure, when I see a child with autoimmunity, now what I look at are I when I do blood work on kids, teenagers mostly, I will also add something called an ANA, anti-nuclear antibody, which is for the listeners, just a very non-specific general autoimmune marker. It does not mean that you have an autoimmune disease, but it's like a little, it's like the canary in the coal mine. It's your immune system saying, waving a little flag saying, "Hey, I'm developing some autoimmune reactivity." Right? So I look at it as not so much as a scary thing, but more as a wow, this is such a great opportunity. We caught this before your child has an autoimmune disease, right? And now we know, okay, your child is their immune system is reacting. Let's figure out what it's reacting to, and let's figure out what are the sources of autoimmune reactivity. And the first place I look is their gut microbiome, because we know that there are some abnormal bacteria, especially these bacteria called Enterobacteriaceae, or these gram-negative bacteria like Klebsiella and Citrobacter, that are known to be correlated with and underlying triggers of autoimmunity, and you clear those out and you can get so many improvements in your child's health. They also underlie a lot of mental health concerns. So I've had kids, with depression and anxiety, where we clear out that gram negative bacteria and something called endotoxemia, because these organisms create something called LPS, or lipopolysaccharides, which are highly inflammatory to the brain and the immune system. I always look at the gut, and I tell parents and kids that, I let them know. I had this one family, that actually the two siblings had Crohn's disease, and the two kids had juvenile rheumatoid arthritis, and the sister also had Crohn's disease. Both of them, working with diet and lifestyle and supplements, got significantly better. But when we cleared their gut Klebsiella, killed the Klebsiella, normalized and restored the gut microbiome, that's when they went into remission. And so it's really powerful. I mean, that the gut, it can seem kind of simplistic. Well, okay, I guess, but they have all this joint inflammation. Doesn't matter. We still start with the gut.
Thank you for tuning into part two of my powerful conversation with Dr. Elisa Song. In part three, we'll uncover 5 simple but impactful things your child can do every day to build lasting health and resilience. Be sure to subscribe and don't miss it, and share the episodes with your friends and family.
MacuHealth is a nutritional supplement leader. Our targeted formulas include MacuHealth for daily eye health, MacuHealth Plus for aging eye support, Vitreous Health for vitreous care, Vision Edge Pro for visual performance in athletes, TG Omega-3 for ocular and systemic wellness, and MacuHealth DM for eye and metabolic support. Call MacuHealth today and mention this podcast for special discounts. Experience the difference with MacuHealth. Nutrition you can see.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight one day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not
Right,
multifocal.
exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode.